Hi, I'm going to show you how to do a quick, rapid head to toe, and I have gotten myself into some wonderful flattering scrub tops, and I hope that this will be helpful to you as you prepare for your head to toe that is coming soon. Okay, so when you come in, you are going to bring in your blood pressure cuff. Your peer is going to be in the bed, and your instructor is going to be on the opposite side of you, and all of these items are going to be on the table. Okay. Knock, knock, knock. Hello. Hi. I'm going to provide patient privacy. Hi, my name is Lydia Tonis. I'm a nursing student with University of West Florida. I am here to take some vital signs and to do a physical assessment on you. Tell me your name and date of birth. Okay, nice to meet you. Do you have any cultural or religious considerations that I should, note before I do this? No? Okay. Well, good. Well, so I've provided patient privacy, and I am going to make sure my hands are clean before I do this. I'm going to take your blood pressure, your temperature, grab your pulse and respirations. Are you in any pain right now? No pain? On a scale of 1 to 10? Oh, okay, good, no pain. Well, we're going to begin by taking your blood pressure. Okay, and I'm going to clean my side off so I don't get any thing from the previous student. And this is going to be for the instructor. All right, have you had any mastectomies or maybe a fistula or a graft or an IV that would prevent me from taking a blood pressure on this arm? No? Okay, wonderful. So I do see that you have an IV down here, but it's far enough down that it shouldn't give us an issue. Okay, let's have you lift that arm for me. Okay, wonderful. Here we go. We're going to do the one-step blood pressure, and I'm just going to put my fingers right here. There is a squishy thing, a sphygmomanometer. And here, instructor, would you like to see it too? So I'm going to put it right there so we can both watch. Okay. Your blood pressure is 116/64. That is a normal blood pressure. I'm going to take the stethoscope and place that right here because we are done with that. A dual head one. And my stethoscope is on my neck. On my neck. Okay. Let's go ahead and check your pulse. Okay, instructor, I am going to go now. And I will be checking it for 30 seconds. And I'm still thinking and counting, and everybody is quiet. Okay. 30 seconds has passed. I'm going to put this on my patient's chest. And now I'm counting respirations. And I'm mentally remembering my pulse because I'm going to double it. Another 30 seconds has passed. Thank you very much. Your pulse is 60 and your respirations are 12. At this time, I'm going to put this on your finger. This is going to measure your oxygen level. Okay, I'm just going to put that right there. And if you don't mind, please open your mouth and say ah. Ah. Okay. Good. Your temperature was 98 degrees. Okay, and your oxygen was 98. Very good. Okay, so at this point, I'm going to go ahead and take a look in your eyes. Before I look in your eyes, I know you told me your name and your birthday. Where are we right now? We're at University of West Florida Hospital. Very good. And what brought you here? Pregnancy. Okay. And what year is it right now? 2020. Excellent. Those are all correct. So now I'm going to look in your eyes And I'm going to make sure that I am not leaning over, so I'm going to have the bed rails down. And if you don't mind, just kind of look straight here at me. Okay, I see that is constrictive and reactive. Okay, it's brisk. Okay, brisk, and it goes down to a 2. Now look at this pen light here, and I'm going to have you draw your eyes close to it, and wonderful. So you're able to follow that, so we call that accommodation. Say ah. Okay, I can see your teeth and your tongue are pink. Wonderful. Click. I'm going to go back in my pocket. At this time, I'm going to take a listen to your chest with my not dual-headed stethoscope. And I'm going to go under your gown. I'm going to listen to 4 sights. Okay. Deep breath. So it was 1, 2, 3, 4. And at this time, I can either listen to your lateral sights or I can listen to your heart. And I'm going to choose to do your heart because I was basically right here. And so now I'm going to the apical pulse. And just hold your breath for me. Okay, I'm listening for murmur. And if it's regular or irregular, which I hear no murmur and it is regular, I'm going to go ahead and proceed down to your lateral sights. Deep breath. Okay. Deep breath. Wonderful. So that was my apical pulse. And then my one lateral sight and then my other lateral sight here. Ma'am, I'm going to actually have you sit up. Oh, this is going to be good. So she is sitting up. I didn't realize how heavy she was. So she is sitting upright. I'm going to be inspecting the bony prominences. I don't see anything on her scapula or on her scalp or on the back of her elbows. Okay, so at the top of her chest. Okay, deep breath. Deep breath. Deep breath. And deep breath. Okay, you are clear. Now at this time, I'm going to hold my questions toward the end, or I could very well ask you, do you have a cough? No. Do you get short of breath when you are standing? No. How about walking? No. Dizziness? No? Okay, good. Well, I'm going to listen to your abdomen and then I might ask you a few questions, or I could reserve them to the very end. Okay, I'm inspecting the abdomen for the shape, which you are round. I'm inspecting for any scars or other abnormalities. And at this time, I'm going to go ahead and auscultate and put my stethoscope on the right upper quadrant. Okay. Okay. When was your last bowel movement? Today? Okay. Any difficulties? Any concerns? Would you say it's normal? Yeah. How often are your bowel movements? Every day? Okay. I'm going to go ahead and touch you. Let me know if you feel any tenderness when I do this. Okay. No tenderness, no pain. Okay. All right. How's your appetite? Your appetite is normal. Any nausea? Any vomiting? None? Okay. I'm just going to inspect your brief at this time. I see that you have a brief on and it is dry. Your urine color, are you able to, do you know when you go? Oh, you're incontinent, that's why the brief. Okay. And any burning upon urination? No burning. Okay, so no difficulties there. And you are incontinent. Good to know. So at this time, I'm going to check your arms. I'm checking for warmth, color, and I'm looking, and I see your color is tan. It is pink. You are warm to the touch because I'm feeling the back of my hand. Your skin is intact. I don't see any wounds. No wounds bilaterally. I do see that you have an IV in your right anterior forearm. The site, the type, so it's a peripheral. It is a 18 gauge and it looks like it was inserted yesterday. Okay. At this time, I'm going to have you squeeze my hands. Squeeze. All right, squeeze. Oh, good grip strength. I want you to pull. Very strong. Push. Whoa. Okay, you are very strong as well. I'm going to put that down. Now, at this point, I'm just going to check for edema, and nothing there. I'm pushing down on your lower wrist, nothing there. This is where I need to check your pulses. Your pulses are bilaterally equal, and I'm going to grade it to a 2+, so they're strong. Good, they're not weak or thready. So after I check your pulses, this would be a good time, and I've already checked your edema, to check your skin turgor. Your skin turgor is brisk. There is no tinting. I'm going to check your cap refill. Cap refill is brisk, it's less than 3 seconds, and the condition of your nails is also, they're smooth, no ridges or discoloration or clipping. Okay. Let's take a look at your feet, ma'am. I'm going to grab a pair of medium gloves. Medium gloves. Okay. I would like you to push down your toes. Whoa, okay, you push down. I'm going to put my hands on top of your feet. Now pull your toes to your nose. Oh, very good. Okay. So your plantar flex was strong. Your dorsiflex was also strong. I'm going to check your pulses bilaterally. They are strong and equal, so 2+ and equal. I'm going to check for edema. There is no edema. Let's look at your heels. Okay, there are no wounds under there, no redness. Your bony prominences look good. And last but not least, your cap refill. Okay, if you have toenail polish on, I will check the tip of your toe, but I can check the toenail. Okay, condition of your nails are also intact. Ma'am, trying to think if I have any more questions. I asked about your cough, your appetite, your nausea, your vomiting. I see that you have a walker at bedside, so I'll make sure to assist you whenever you are going to a bedside commode or anywhere else. I'm going to make sure my bed is nice and low, and I see that you are on oxygen. Looks like 2 liters there, and you have that right warm IV with fluids going. Fluids are intact, and please make sure to do your spirometer. Okay, let me know if you need anything, but I will be back in probably another hour. Thank you.